Hi, I'm Dr. Parich from Parich Eye Center. I just wanted to talk to you about some issues that people can have with dry eyes and a condition called blepharitis. Blepharitis is inflammation around the eyelid margin. There are a couple different things that can cause that, and one of them can be an actual eyelash infection from something that's a bacteria like skin flora that's completely out of control and growing all over the lashes. Also be from a little mite, yes, indeed a mite, that lives inside the eyelash glands, inside the individual hair follicle, all right? It's a mite that lives in the hair follicle. It's called Demodex. It's not the same one that dogs get. It is human Demodex, and it is spread from personal contact, whether it's sharing bedding or towels, things like that over time in your life. And believe it or not, just like MRSA, most people actually have this by their fifth decade, sixth decade, seventh decade. Very, very common in my patient population. However, it's not causing symptoms for a lot of people. So it's just a very mild, chronic, low-grade inflammation and infection of the eyelash glands. However, we do want to treat this condition and clear it. Now, specifically, I have some products in my clinic that we use to treat this condition called Oust. It is a 1% tea tree oil solution. So we can do an in-office cleanser with 100% tea tree oil solution as just kind of an initial bang to get it under control. But we have to put numbing agent on the surface of the eyes, and this has to be done by the doctor. It's a little tear open swab that I clean the eyelashes and leave it on for 10 minutes. And then I'll also do the eyebrows as well, because those hair follicles can be affected as well. So, but leave that on for 10 minutes. Again, please only done in the doctor's office, because we have to use topical numbing agents as well as protect the surface of the eye. And look at the cornea afterwards, make sure there's no corneal abrasion. That's a very big situation that could happen if you're using 100% tea tree oil around your eyes. So leave that to the professionals, guys, all right? And then we send you home with eyelash cleansers to use daily. Now these are a tear open packet, all right? So you just open this like this, and then you would clean your eyelashes with this little pre-moistened towelette with the 1% tea tree oil on it, right along the eyelash margin, okay? So you wanna get in there real close with your eyes closed, and you can flip it over and then use the same pad on the other eye. I would say scrub for a couple of minutes and then leave this on for at least 10 minutes. You can leave this solution on for the rest of the day. That's completely safe and okay. It's very, very important that you wash all your sheets and towels on hot. We wanna kill the stuff that's on your sheets and towels. So pillowcases and face towels should be washed daily. Yes, change daily, washed. So get some extra pillowcases to have and face towels. Wash it all on hot. And this has to be done for 3 months straight, in addition to treating partners. So anyone you're sharing bedding with, because you can reinfect yourself with your own towels, or your partner can have it and you guys can just share it back and forth. So again, this is Demodex blepharitis. I treat this all the time in my clinic, and it takes about 3 months to eradicate it. I tell everybody, don't even bother doing this process if you're not gonna stick with it for 3 months, because the nits, the female Demodex mites, have eggs, and the eggs can last on the hair follicle. So that can be up to 90 days. So make sure you do the full 90 days of therapy. All right, do it at home.